There's a need for mental health services now more than ever, but health experts say it's been a struggle to meet the high demand for care during the pandemic. Our Kenesha Dees spoke with a Huntsville therapist about how this impacts us right here in the Tennessee Valley.
There has been a shortage, and some counselors and some therapists in the mental health section are not able to see patients as rapidly.
The U.S. Government Accountability Office reports in a February survey, 2/3 of members surveyed from the National Council for Behavioral Health saw higher needs for mental health services and have had to cancel or reschedule patient appointments, even turn patients away.
Where you can find a therapist or a psychotherapist that will be able to help you maybe in the immediate time frame, or they will at least be able to put you on a waiting list. We actually communicate via email, and we are always out here looking for different resources, different support groups, and just anyone who has availability within a week's time frames.
The Health Resources and Services Administration also project that by year 2025, there will be shortages of 7 types of mental health providers, including psychiatrists, clinical counseling, and school psychologists.
By 2025, hopefully, there will be some other counselors and social workers, or even some other students who start to look at psychology and say, hey, that's something that I actually might want to get into.
Psychotherapist Monretta Vega says her clinic is really leaning on what they've learned in the past year during the pandemic and accommodating patients in any way they can.
For Huntsville Psychotherapy and Counseling Services, we are going towards not only having in-person sessions, but telehealth services as well, which will actually be able to provide something dual and provide a bigger population.
Putting the Valley first, Kenesha Dees, WZDX News.